And so you graduated from the Osher Research Fellowship in Integrative Medicine several years ago, I think, at this point. So I'm wondering, how did your experience as an Osher Fellow shape and move your work forward in this arena?
My work at Osher was predominantly looking at yoga therapy and how yoga therapy could be offered to a group of particular folks that need. So it was pregnant women at that time, and to look at how a yoga protocol could affect not only low back pain, which was the primary outcome, but other components that were included in wellness. And we were comparing yoga class with just an educational arm of people who were showing up and having a facilitated just peer group educational experience about certain topics in pregnancy. So it was this component of looking at the group effect as well, in terms of when people come together and engage in a self-care practice, whether it includes yoga or just say talking about the symptoms of low back pain during pregnancy with a group of peers who have a similar experience. We wanted to see if there was a difference, with yoga really being the difference. But I became really interested in the peer group component around healing and how communities actually can create a healthy healing environment for folks. So with Paula Gardner's work with the group medical visit, I was really influenced by her work. And there were other components as too. So Ted Kapchak's work in terms of the effects of sort of the placebo effect, in terms of like how people's belief systems influence their healing capacity. Those are all connected into what could be a potential more effective healing experience with the use of a psychedelic state. And so psychedelic state is just something to clarify, because ketamine is not a classic psychedelic, though it creates an expanded state of consciousness that could be quite psychedelic-like in experience. And so through the support of Osher, I learned a lot about the research studies that were happening. I learned about how to conduct research studies through the yoga trial. And I was also paying attention to what are these ways to increase access of integrative medicine modalities, because I cared a lot about this sort of narrowing, like in the clinical research trials that were happening at Hopkins or NYU in terms of psilocybin, say, as a psychedelic substance. There was just a lack of accessibility. And so I was really inspired by the group medical visit model. And from those, we've actually expanded our ketamine therapy to not just be a single patient client who's having an experience, but now we run small groups of 6 people, sort of interweaving the group medical visit model with group therapy and using ketamine, not for every single group, but using ketamine at strategic times so that the group can have a shared experience and then do their process and healing and integration afterwards.